Dave Metz with FM3 Research is a highly experienced pollster on a range of issues affecting our lives. He is one of the lead researchers on the bipartisan team for Pulse, a new poll from the Colorado Health Foundation. Dave, as you well know, after this most recent presidential election, there's a lot of skepticism around polling. So what do you believe has to change in order to produce poll results that are accurate and that people can have more confidence in?
So I think there are a number of steps that we can take to reinforce the accuracy of polls, and a lot of them are things that we already are doing as part of the Pulse poll for the Colorado Health Foundation. Having a multimodal survey where we interview people on landline phones, on wireless phones, through text messages, and also through email invitations. Having more time when we're in the field looking for respondents and asking questions. We spent 3 weeks in the field with the Pulse poll, and that allows us to take more time to follow up, make sure we're getting a diverse set of respondents to participate. Doing the survey in languages other than English, in the case of the Pulse poll, and in both English and Spanish. Being able to have a sponsor for the poll that's trusted and nonpartisan so that participants of all different backgrounds can have some confidence that there's not an ideological agenda driving it. And most importantly, having a poll that's concise and focused on nonpartisan content that is relevant to issues that matter in people's everyday lives. The public doesn't lack for strong opinions, and if they're given a chance to share them in ways that they think are meaningful, being asked questions that are sort of directly relevant to their day-to-day experiences, we often find that they're eager to participate.
The Pulse poll seeks Coloradans' perspectives specifically on issues affecting their health and their well-being. Did you see any ways in which the results from this new poll played out in the election?
Absolutely, Bazi. I think there were a couple of issues that Coloradans really called out as concerns in the poll that we saw have impact in races both in Colorado and across the country. One was healthcare. For years, we've seen the cost of healthcare be a top concern. That remained the case in the Pulse poll, and there were lots of candidates on both sides of the aisle who, with different policy prescriptions, still were putting healthcare at the center of their appeals to voters. And there's a lot of data post-election to suggest that was one of the things that was driving voters' thinkings when they made their choices. Second, the poll showed a lot of concern about interactions with police and police practices, particularly among younger residents of the state, those in lower income households, communities of color, or members of the LGBTQ community. And everywhere across the country that there were ballot measures to promote police accountability, transparency, or civilian control, they tended to pass overwhelmingly. And then third, obviously the coronavirus was a significant issue on the minds of Coloradans in the poll, not just its impacts on public health, but its impacts on the economy and on education. And there's lots of evidence that that was driving voters' choices this year, in particular those for federal offices like president.
Regarding the health-related research that you do with the Pulse poll, why is that research so important? How might having this information about what others believe and what they're experiencing, how might that affect us?
Sure. Well, I think it's important to remember that most policymakers and elected officials spend their time in an environment where there's a small group of people that are constantly trying to get in their face or get on their Zooms and tell them what the public thinks and urge them to vote a certain way, to shape certain policies based on what this group is representing public opinion to be. But the truth is there's a broad population of Coloradans out there who either don't have the time, don't have the inclination, or don't really have the knowledge to understand how to make their voices heard as part of the policymaking process. So public opinion research is an important tool to understand what that broader and more representative sample of the state's residents thinks, and try to bring that to the forefront and make it possible for policymakers to listen to that broader population as they're deciding what to do. I also think it's important to not just take one poll as a snapshot at a moment in time and sort of use that to guide you going forward, but to check back in. And that's the plan with the Pulse poll. It's going to be repeated on an annual basis so that we can have that understanding of the ways that public opinion is evolving and make sure that those voices continue to be heard by policymakers as they're making decisions that will affect Coloradans' lives.
We look forward to those future polls. Dave Metz, thank you.
Thank you, Bazi.
Check out copulsepoll.org for more on what Coloradans think about issues affecting their health and well-being.